In case you missed Daybreak this morning, we had quite the party on the plaza, or I guess in this case in the studio since it was so cold. A lot of folks from the American Heart Association showing up, waking up early to join us, sporting their best red outfits for Wear Red Day. A lot of fun all around there, so we thank them again for being here. But this is all to highlight a very serious issue, you guys, heart health. And joining me is Dr. Fahmi Farah. She's a cardiologist with Baylor Scott & White in Fort Worth. Thank you so much for being here.
Thank you for
Love your red.
Me. Thank you.
So
likewise.
I want to talk about young women because this is such a hot topic. Why are we seeing instances of heart disease in younger and younger women in their 20s, 30s, 40s?
That's an excellent question. So yes, according to the new CDC census that came out since 2011, the rate of heart disease in young women have nearly doubled compared to men. And we think some of the reasons are probably due to stress. Stress is a big factor, as you know, because now women have more than just one duty. They have career aspirations, but then the traditional role of a woman didn't really go away, so stress is a big part of it. Diet is another big part. Heart healthy diet definitely plays a role. Risk factors are increased as a result of stress and diet, which means high blood pressure, hypertension, high cholesterol. We're seeing all of these things pop up a lot earlier in younger women. Yeah. And I think all of these things are contributing to the increased rate.
Well, I mean, I teach yoga and meditation, and we talk about how studies have shown just 5 minutes of meditation per day can really reduce your stress level. So that's one thing that you can take away. You can do it for free, right, anywhere, at any time. It's so important to quiet the mind. Why does heart disease affect men and women differently?
So that's a very good question. Heart disease in men, it's been known for the longest time that heart disease is a men's disease, which is clearly not so. But we believe there are multiple different factors that are involved in women. So for example, microvascular disease is one of the things that we think affects women more than men. But more than how it affects, it's more about the symptoms. So women actually present symptoms differently. They usually present with atypical symptoms. For instance, they may not have chest pain at all. A lot of women will have indigestion-like symptoms like nausea, vomiting, fatigue, shortness of breath. So it gets missed a lot as a result of that.
Yeah, we had a woman on this morning. She said her main symptom was she had back pain.
Yes.
And I'm like, back pain. I had a friend whose mom had a stroke earlier this week, and her doctor said it was due to high blood pressure and stress.
Yes.
And she's active, and I think that a lot of times we think that, oh, this is like older people who deal with this, but someone in their 40s and 50s, it's not true.
Yeah, that's a very good point you brought up, that someone early had a stroke. I have a patient who had a heart attack in her 30s. I think more than like the fact that it's different between men and women, it's more about the symptoms. And when it goes down to the mechanism, the actual mechanism of why it's different, we have yet to work on that to find out, because so far in cardiology, all the research that we have available to us, for the most part, they were all geared towards men. So we really don't have a clear answer as to how women are being affected. So the fact that we're becoming more aware that women are presenting differently, it should shed a new light that we need to work more. We need to invest more resources. We need to include more women into the study so that we can finally get down to the bottom of why are we different.
Great point. Thank you so much for being here.